Imagine this scenario. You've got a beautiful, vibrant new foal full of that clumsy, adorable energy.
Yeah, the first week or two.
Exactly. You've watched it take its first steps, nurse, explore. Then, almost overnight, it's struck down by just debilitating diarrhea, lethargy, and it's like that spark is just gone.
It's heartbreaking to see. And unfortunately, all too common.
For anyone involved in horse breeding, this isn't just a sad thought. It's a familiar and honestly often devastating challenge. So today, we're taking a deep dive into Foal Rotavirus. This isn't just a problem, it's actually the most common infectious thing causing diarrhea in foals globally.
Yeah, it's a huge deal, a critical, ongoing challenge for breeding farms everywhere.
We're talking high morbidity, meaning it spreads like wildfire through susceptible foal populations, and a really significant economic impact. Think vet costs, extra labor, disrupted productivity. It adds up fast.
Oh, definitely. The cost can be enormous.
So, our mission for you today is to really unpack the complexities of foal rotavirus. We'll explore what it is, how it attacks the body, dive into some of the cutting-edge diagnostic methods.
And look at current treatments, yeah.
Yeah.
And also how prevention and control are evolving.
Exactly. It's about getting you well-informed quickly and thoroughly so you understand what's really happening on the ground when this virus strikes. So let's start at the beginning. What exactly is rotavirus? And why is it such a tough opponent for these young foals?
Well, fundamentally, it's a non-enveloped RNA virus. And the key thing, it's incredibly contagious.
How does it spread mainly?
The primary route is fecal-oral. So foals basically ingest it from contaminated environments or through direct contact.
Okay, fecal-oral. Pretty standard for gut bugs.
Right, but what's fascinating, or maybe alarming, is how little it takes. As few as like 90 to 100 viral particles can actually infect a susceptible foal.
90, that's practically nothing.
It's an incredibly low infectious dose.
And then I guess once a foal is infected, they become a sort of viral supershedder, right?
That's exactly the term for it. Infected foals can shed just immense quantities of the virus in their diarrhea. We're talking up to 10 billion particles per gram of feces.
10 billion per gram. That's astronomical.
It is. And you couple that with the virus's remarkable environmental stability. I mean, it can survive up to 9 months at room temperature and still be infectious.
9 months? Wow.
Yeah, and that's why you see these recurrent outbreaks. It just persists in the environment, making it a really persistent, frustrating challenge on breeding farms.
So who does it hit the hardest then? And how does it actually, do its damage inside the foal?
Well, clinical disease is typically seen in foals under 6 months old. Most commonly, maybe under 3 months.
Okay.
But the real danger zone, the highest risk, is foals under 1 month old, especially those just 2 weeks old or younger.
Why them specifically?
It really comes down to their physiology. Their little bodies just have a very limited ability to correct fluid and electrolyte loss, so they become incredibly vulnerable to rapid, potentially life-threatening dehydration.
Okay, so that's the risk factor, but what's the virus actually doing in there? What's the mechanism that causes such severe illness?
So the core mechanism, rotavirus, doesn't just cause diarrhea. It fundamentally cripples the foal's ability to absorb any nutrients from milk.
Okay.
Think of the foal's small intestine, right? It's like this super efficient sponge designed to soak up vital nutrients. What rotavirus does is essentially shred the surface of that sponge. It specifically attacks and destroys the mature cells right at the tips of the villi.
The villi. Those are the little finger-like thing.
Exactly. The ones that massively increase the gut's surface area for absorption. This destruction, we call it villus atrophy, it just dramatically reduces the ability to absorb fluids.
Okay. Less surface area, less absorption.
Right. And on top of that, it particularly messes with lactase activity. Lactase is the enzyme needed to digest milk sugar, lactose.
Ah, so they can't digest their milk properly.
Precisely. So that undigested lactose travels down to the large intestine, and it pulls water with it osmotically. That causes that profuse, watery diarrhea.
It's like a double whammy.
It is. And there's more. The virus even deploys a type of viral toxin, NSP4, that actively inhibits the gut's sodium glucose transporters, the pumps that help absorb fluids and sugars, and further reduces enzymatic sugar breakdown.
So it actively blocks absorption, too.
Yes. It accelerates the dehydration and cell damage. Basically, it turns their main food source, milk, into something that actively dehydrates them. It's a really devastating cycle, very hard to break.
Wow. And you mentioned the significant economic impact earlier. We're not just talking about a few vet bills here, are we?
Oh, no, not at all. It can be substantial.
Like, there was that one example, right? On a standard bred farm?
Yeah, the case study.
Yeah.
An outbreak affected 54 foals. The estimated financial risk was somewhere between $2 and $3 million.
2 to 3 million. How does that break down? Is it just the treatment costs?
It's way more than just direct treatment, although that's significant, prolonged IV fluids, meds, but it's also the massive increase in labor. You need round-the-clock intensive nursing care.
Right, pulling staff off other jobs.
Exactly. It can divert staff from other critical tasks, potentially delay breeding schedules for the mares if things get bad. It can compromise the future sales value of affected foals.
And just the sheer emotional toll, I imagine.
Absolutely. The emotional and financial exhaustion for everyone involved, the farm owners, the managers, the staff. It's not just a scientific problem, it's a profound challenge to their livelihood, their passion. It can genuinely destabilize a smaller farm or put huge stress on larger operations.
So a heavy burden financially and emotionally. And if that wasn't enough, the virus itself isn't static, is it? It changes.
That's right. It's an evolving threat.
In fact, one of the biggest curveballs, particularly recently, has been the emergence of entirely new strains. Like, historically, we mostly worried about Group A rotaviruses, right? ERVA.
Correct.
Yeah.
Historically, it was Group A ERVA in horses.
Yes.
Strains like G3P4 and G14P4 were the usual suspects we look for.
But that picture has changed dramatically.
It really has. The crucial twist here, the really significant development, has been the emergence of novel Group B rotaviruses, ERVB.
Group B.
These started showing up in foal diarrhea outbreaks, particularly noted in central Kentucky, starting around 2021.
And where did this Group B come from?
Well, when they did the molecular analysis, looking at the genetics of these new ERVB strains, they found they shared over 96% identity with Group B rotaviruses previously found in ruminants.
Ruminants, like cattle and goats.
Exactly, cattle, goats. It strongly suggests a cross-species transmission event happened. The virus jumped from ruminants to horses.
Wow, so it jumped species.
Yeah, highlighting just how incredibly dynamic these viruses can be and how they can adapt to new hosts.
So this discovery of Group B, I mean, that truly challenges everything we thought we knew about host specificity, doesn't it? What are the immediate, practical implications of that? For testing, for vaccines?
Absolutely. It blew the lid off the assumption that equine rotaviruses were strictly, horse-only viruses.
Right.
Practically, it means your standard diagnostic tests, which were often designed only to detect Group A, might completely miss these new Group B infections.
Which means you might not know what you're dealing with.
Exactly. That's a huge problem for getting an accurate and timely diagnosis. And, of course, it dramatically impacts vaccine development.
Because the current vaccines won't work against Group B.
Correct. Current vaccines target Group A strains, primarily G3. They offer no protection against these new Group B strains.
This really brings that One Health idea into focus, doesn't it? The connection between animal and human health.
It absolutely does. This situation really underscores that interconnectedness. And it goes both ways, actually. For instance, equine-like G3RVA strains, Group A strains similar to those in horses, have even been identified as emergent viruses infecting children.
Really? Horse strains infecting kids?
It raises very real potential zoonotic concerns. It shows these viral families can be quite fluid across species lines.
And it gets even more complicated, doesn't it? Because beyond the foals that are obviously sick, there's this kind of stealth factor at play with rotavirus.
There is indeed. You've got the clinically ill foals, the ones with the obvious diarrhea, but then you have older immune foals that can act as subclinical shedders.
Meaning they look fine, but they're spreading the virus.
Precisely. They carry and shed the virus without showing any signs of illness themselves. And what's more, the mares of infected foals can also shed the virus without showing any clinical signs.
The mares too. Wow.
Yes. So this asymptomatic shedding, you combine that with the virus's incredible environmental stability and that super low infective dose we talked about.
Right, the 90 particles in 9 months.
Yeah. All that together makes outbreaks notoriously difficult to control. Even on farms with really good established biosecurity protocols, it's not just about managing the visibly sick ones.
Okay, so when a foal does get sick, diagnosing it quickly is absolutely crucial, especially with that risk of rapid dehydration. What does a typical rotavirus case look like clinically?
Usually the hallmark is profuse, watery diarrhea, often quite malodorous, unfortunately. And that's accompanied by depression, lethargy. The foal might stop nursing, or nurse less, so anorexia. Abdominal distension, like a bloated belly, and signs of colic are also common.
And it's the really young ones we worry most about.
Definitely. Those very young foals under 2 months, but especially under 2 weeks old, they experience the most severe signs and are at the absolute highest risk for that rapid, life-threatening dehydration.
What are the signs of severe dehydration we should watch for?
You might see things like sunken eyeballs, a prolonged skin tent, when you pinch the skin on the neck and it stays tented up for too long.
Right.
Also abnormal pulse or respiration rates, pale mucous membranes in the gums, general weakness, trembling, and in severe cases, even collapse.
So the key is not to wait for those extreme signs.
Absolutely. The key is heightened suspicion and prompt diagnostic action. Don't wait until the foal looks like it's about to collapse. Act fast.
Okay, so you suspect rotavirus. What about laboratory diagnostics? You mentioned it's a multi-pronged approach.
Yeah, we use several tools. There are rapid antigen detection kits, sometimes called RED kits.
Like the dipstick test?
Exactly, dipstick or latex agglutination tests.
Hmm.
They're quick, cost-effective, great for initial screening right there on the farm.
But they're not perfect.
No. Their main limitation is sensitivity, especially at lower viral loads. They might miss some cases. Their practical sensitivity is probably less than 90%.
What else is in the toolbox?
Well, historically, electron microscopy, or EM, was used. It's sensitive and specific if you have enough virus. But it requires a high viral load, and it's really limited to specialized labs, not something you can do farm side.
So what's the gold standard now?
The gold standard for detection, confirmation, and importantly for genotyping the specific strains, like telling apart ERV-G3, ERV-G14, and the new ERV-B is RT-PCR, especially real-time RT-PCR.
Why is that the best?
It's just vastly more sensitive, like 2 to 4 logs more sensitive, meaning it can detect tiny, tiny amounts of virus that other tests would miss, and it tells you which strain you're dealing with.
That's crucial with the new strains emerging.
Absolutely. And then for advanced research, there's next-generation sequencing, NGS. That gives you the full genome analysis and was actually instrumental in identifying that novel ERV-B strain back in 2021.
And blood tests play a role too, right? Clinical pathology?
Oh, definitely. Blood tests give us crucial insights into the foal's overall state. We look at hematology, things like a high hematocrit, which signals dehydration. The leukogram, or white blood cell count, tells us about the immune response.
Inflammation markers.
Yes, elevated acute phase proteins like fibrinogen or serum amyloid signal serious inflammation. And biochemistry panels reveal those critical electrolyte imbalances. Low sodium or hyponatremia is seen in up to 2/3 of cases. Low potassium hypokalemia in about 1/3.
And you mentioned acidosis.
Yes, and strong ion metabolic acidosis is very common. Basically, their body's pH balance is dangerously off because of the diarrhea and dehydration.
It's also really vital to differentiate rotavirus from other things that cause foal diarrhea, right? It's not always rota.
Exactly. You have to consider other possibilities. There's a whole list of differentials.
Right.
You've got bacterial causes like Clostridium perfringens or Salmonella, other viruses like equine coronavirus.
Parasites?
Yeah, parasites like Strongyloides westeri or Cryptosporidium parfum. And then there are non-infectious causes too,
Such as?
like foal heat diarrhea, which is usually mild, self-limiting, happens around 5 to 15 days old, and the foal doesn't act systemically sick. Or it could be dietary imbalances or even a primary lactose intolerance, though that's less common.
So how do you sort through all that?
Often, vets will use fecal cultures to look for bacteria and molecular PCR panels. These panels can screen for multiple agents, bacteria, viruses, parasites, all at once from a single fecal sample, giving a much more complete picture.
Okay, so let's talk treatment. You diagnose rotavirus. You mentioned there's no direct antiviral therapy. So what do you do? Let's unpack that. Treatment is primarily supportive, right?
Yeah.
Managing signs.
That's exactly it. Since we can't directly chill the virus, the entire focus is on supporting the foal through the infection, managing those clinical signs until its own immune system can clear the virus.
And number one priority must be fluids.
Absolutely. Fluid and electrolyte management is the single most critical component, period.
What does that involve?
It usually means intravenous or IV balanced isotonic crystalloids. Things like lactated Ringer solution, plasmaloid A, Normasol R. The key is careful monitoring and gradual correction of those electrolyte problems, especially sodium and potassium and the metabolic acidosis.
And you have to be careful what else you give them.
Yes. Crucially, you have to avoid any drugs that could be nephrotoxic, meaning harmful to the kidneys because the kidneys are already stressed from the dehydration.
Makes sense. What about nutrition? They need energy.
Nutritional support is also paramount. Continued nursing, if the foal is willing and able, is ideal because mare's milk provides essential nutrients and antibodies.
What if they won't nurse?
If nursing is restricted, then specialized powdered milk replacers designed for foals are preferred over something like fresh cow's milk.
Why not cow's milk?
Cow's milk has a higher fat and lower sugar content compared to mare's milk, and that can actually sometimes worsen diarrhea in foals. The key is frequent small feedings of an appropriate replacer.
And basic nursing care, keeping them clean and warm.
Hugely important. Maintaining a clean, dry, warm, temperature-controlled environment is crucial. And preventing fecal scalding, where the constant diarrhea irritates the skin around the tail and hind legs, by cleaning gently and using water-repellent ointments is important for comfort and preventing secondary skin infections.
Okay, what about specific medications? Are there things that can help with the symptoms?
Yes, there are some adjunct therapies. Lactase supplementation can be beneficial.
Because the virus damages lactase production.
Exactly. So giving lactase enzyme can help improve lactose digestion and hopefully reduce some of that osmotic diarrhea.
What about protecting the gut lining?
Gastrointestinal protectants are often used. Things like bismuth subsalicylate or intestinal adsorbents like ditrioctahedral smectite. Biosponge is a common brand. Sometimes ulcer medications like omeprazole or sucralfate are used too to help mucosal healing and prevent stress-related ulcers.
Antidiarrheals.
There are some options sometimes considered, like Neonorm Foal, which contains crofalamer, or bismuth subsalicylate again, which has multiple actions.
Now, antibiotics, this is a crucial point, right? They don't treat the virus itself.
Absolutely critical point.
Great.
Antibiotics have no effect on the rotavirus infection itself. They're only used prophylactically in certain cases.
Prophylactically meaning preventatively.
Yes. If there's concern about secondary bacterial translocation, meaning bacteria crossing the damaged gut barrier into the bloodstream, or if there's evidence of sepsis developing, then antibiotics might be used, but not routinely for every case.
Okay. Now, probiotics. We hear so much about them for gut health in general. Are they helpful here? You hear them mentioned a lot.
Yeah, that's a really important question. Probiotics are very widely used, almost reflexively sometimes.
But does the science back it up for foal rotavirus?
Honestly, the peer-reviewed evidence for their efficacy, specifically in foals with rotavirus diarrhea, is, well, the studies describe it as underwhelming and often conflicting.
Underwhelming. So not a magic bullet then?
Far from it, based on current evidence. It's not that they have zero potential, perhaps, but the strong scientific backing just isn't there yet to recommend their routine use with confidence in these cases.
Are there downsides?
Yes, there are actually legitimate concerns about potential adverse effects. Some studies or reports mention worsening of diarrhea, depression, anorexia, even colic, particularly if high doses are used.
Oh, wow.
And another issue is inconsistent quality control in some products. You could inadvertently be giving toxin-producing or even pathogenic bacterial strains if the product isn't manufactured properly.
So definitely proceed with caution on probiotics.
Exactly. Caution is definitely warranted. It's an area needing much more rigorous research in foals.
Managing complications is also a big part of treatment, isn't it? What are the major things to watch out for?
Right. Besides the dehydration, electrolyte issues, and acidosis, which we manage with fluids, secondary bacterial infections are a concern, hence the potential prophylactic antibiotics in at-risk foals.
And laminitis is a risk too, even from diarrhea.
Yes, sepsis-related laminitis is a serious potential complication if bacteria do translocate and cause systemic inflammation. It can be devastating for a foal.
Is there anything you can do to prevent that?
Yes, cryotherapy is often recommended as a prophylactic measure. This involves continuously cooling the hooves down to about 5 to 10 degrees Celsius.
Icing their feet, basically.
Continuously, yes, using ice boots or specialized systems. The idea is to initiate it early if sepsis is suspected and maintain it for maybe 48 to 72 hours to reduce inflammation in the feet.
Interesting. Any other major complications?
One other, though it's rarer, is intussusception.
What's that?
That's where a segment of the bowel telescopes into the section next to it. It can cause a blockage and requires prompt diagnosis and often surgery,
How do you diagnose it?
usually via ultrasound. It often shows a characteristic bullseye or target-like appearance on the scan. If seen, it's typically a surgical emergency.
Okay, so treatment is intensive supportive care and managing complications. How do we try and prevent this whole mess in the first place? It sounds like a two-pronged approach. Vaccination and biosecurity.
Exactly. Let's start with vaccination. There is an inactivated Group A vaccine available, like the one from Zoetis.
And that's given to the mare.
Correct. It's administered to pregnant mares, typically a series of 3 shots at 8, 9, and 10 months of gestation.
And the goal is?
The goal is to boost the mare's antibody levels, specifically in her colostrum, that first milk. The foal drinks the colostrum and gets those antibodies, providing passive immunity early in life.
And does it work?
It has been, quote, immensely helpful in preventing neonatal diarrhea associated with the ERVA-G3 strain, which was historically the most common one. It definitely reduces the incidence and severity of disease caused by that strain.
But there's a but, isn't there? Here's where it gets really interesting, or maybe frustrating. What are the limitations?
Yeah, there are significant limitations. The current vaccines primarily target that G3 strain. They offer limited efficacy, maybe some cross-protection, but not great, against the other main Group A strain, G14.
And crucially,
They offer no protection whatsoever against the newly emerged Group B rotavirus, ERVB.
none at all.
None. And remember that study we mentioned? It found that a high percentage, 83% of infected foals in one outbreak investigation were actually born to mares who had been vaccinated according to protocol.
Wow, 83%. That really highlights the gap. So even with vaccination, you're not fully covered?
Not against all strains, no. That's the reality now.
So what's on the horizon for better vaccines?
Yeah.
Is research moving forward?
Oh, yes, definitely. There's promising research into novel vaccine platforms. For example, mRNA-based vaccines, similar technology to some COVID vaccines.
And what are they showing?
Early studies suggest these mRNA candidates can produce higher and more long-lasting antibody levels against both G3 and G14 ERVA strains in mares, and potentially might require fewer doses. So hopefully, broader and more durable protection is coming.
That's good news. But until then, and even with better vaccines, biosecurity on breeding farms must be absolutely critical, right? Especially given how contagious this virus is and how long it survives.
It's indispensable. You simply cannot rely on vaccination alone, especially with the current gaps. Stringent biosecurity is non-negotiable.
So what does truly stringent biosecurity look like when you're dealing with something like rotavirus? Where do you start?
You have to understand the enemy. Rotaviruses are non-enveloped viruses. That means they're resistant to many common disinfectants that work well against enveloped viruses.
Okay, so your average cleaner might not cut it.
Probably not. You need disinfectants known to be effective against non-enveloped viruses. Things like certain phenolic compounds, Tektrol or one-stroke Environ, are examples, or accelerated hydrogen peroxides.
But just spraying disinfectant isn't enough, is it?
Absolutely not.
Yeah.
This is crucial. You must thoroughly remove all organic matter first. Feces, dirt, bedding, milk residue. Because organic material inactivates most disinfectants, you need to clean meticulously before you disinfect.
Clean then disinfect. Got it.
And here's another huge point regarding environmental persistence. Contaminated bedding and manure should never be spread on pastures that foals or weanlings will use.
Because of that 9-month survival time.
Exactly. You could just be reseeding the environment with infectious virus months later. That contaminated material needs to be composted properly or disposed of safely away from susceptible animals.
Okay, so cleaning and disinfection are key. What about managing movement on the farm? People, equipment?
Traffic management is vital. Limiting the movement of people, vehicles, and even other animals in high-risk areas like foaling barns or foal paddocks.
How do you do that practically?
Things like having dedicated footwear for specific barns, using disinfectant foot baths correctly, making sure they're clean and the disinfectant is active. Avoiding things like pressure washing inside barns when animals are present, because that can aerosolize viral particles and spread them.
What about sick foals or new arrivals?
Immediate isolation of any sick foal and its mare is critical. And strict quarantine protocols for any new horses coming onto the farm or horses returning from shows or clinics. That quarantine should ideally be 7 to 30 days, depending on the farm's risk assessment.
Anything else? Stocking density, PPE.
Reducing overcrowding, so lower stocking density, definitely helps slow transmission if an outbreak starts. And yes, consistent use of personal protective equipment, disposable gloves, maybe disposable boots or dedicated boots for isolation areas, using dedicated equipment for sick foals, and of course, thorough hand washing between handling animals.
It sounds like a lot to manage constantly.
It is. It requires vigilance.
And wrapping this all up, why is control still so challenging even with all these measures in place? What's the kicker?
It really comes back to that asymptomatic shedding we talked about earlier.
Right, the healthy-looking shutters.
Exactly. Both immune foals and the mares of infected foals can shed the virus without showing any clinical signs. This just makes effective control incredibly difficult because the source of infection isn't always obvious. It necessitates a proactive, holistic biosecurity approach that operates all the time, not just when you see sickness.
So looking ahead, besides better vaccines, what else might help?
Well, ongoing research is also looking at things like improved biomarkers for really early detection of infection, maybe even before shedding starts or before clinical signs. That could allow for more targeted interventions, maybe reducing the need for broad antimicrobial use.
Okay, so what's the bottom line here for tackling foal rotavirus? It sounds like there's no single silver bullet.
Definitely not.
You've really got to hit it from all angles, haven't you? It's about pinpointing the problem fast with accurate diagnostics.
Yes, early and accurate diagnosis is key.
Then giving those sick foals really aggressive, intensive supportive care, especially fluids,
Absolutely. That supportive care is life-saving.
and running a super tight ship with your biosecurity, constantly adapting it, it really is a full-on battle plan.
It truly is a multifaceted approach,
Yeah.
and it has to be because it's such a dynamic challenge. As we've seen, the virus is constantly evolving, new strains are emerging.
Yeah.
It underscores the ongoing need for research, vigilance, and adaptation from everyone in the equine industry.
Absolutely. So here's a final thought for you, our listeners, to ponder. Given this persistent environmental nature of rotavirus, its ability to hang around for months, and its now proven ability to jump between species, what does this ongoing arms race between viral evolution and our prevention strategies really mean for the future of animal health, and maybe even for our own health? How might understanding these complex dynamics in foals, this interplay of environment, virus, and host, actually inform broader One Health approaches as we face future infectious disease challenges across species? Something to think about.